Okay, going to our next section, we have the extra label drug use, which is used prescribed only by a veterinarian. And looking at our handout here, I'm going to talk to you a little bit about some of the things as far as to look into. The veterinarian increases dosage beyond the label on the extra label drug use being prescribed only by the veterinarian. The veterinarian changes frequency and administration beyond the label. Some other things as far as the veterinarian can do: veterinarians can change the duration of treatment. Veterinarian changes disease to be treated, and the veterinarian changes species to be treated. Also, veterinarian prescribes any other non-label use of OTC or drug being used. And all these were some examples of extra label drug use prescribed only by a veterinarian. Off-label drug use, producer uses without veterinarian approval. This is illegal. Once again, this is illegal. Going to our next slide, we're going to look at some of the questions that are going to be asked for you all to complete. I'm going to give you a little bit of time to go over these questions. And one of the things to look at is before those questions, it says the label of each situation. Label these answers as extra label, off label, or if it's okay. Okay, continue answering as much as the questions as you can, but we're going to take looking at question number 1, and we're going to answer these questions. For example, number 1, the label says to give 10 cc's of the drug. Your vet says to give 20 cc's. This would be an example of, and the answer is extra label. Once again, you have your veterinarian making the decision there as far as what you should do. Number 2, your animal is diagnosed with foot rot and you treat it with an OTC medication approved for root rot. What would this be? And the answer would be okay. Number 3, you decide to use a drug for pneumonia to treat your animal's ringworm without consulting a veterinarian. Your answer would be off-label drug use. This is illegal. Number 4, you use a drug approved for chickens on your sheet without checking with a veterinarian prescribing it. This would be an example of off-label. Once again, this is illegal. The label says to treat the animal twice a day, and you treat it once at 8 a.m. and once at 8 p.m. This is an example of being okay, because you're still doing it twice a day. Number 6, the label says treat once daily, and your vet tells you to treat the animal at 6 a.m., noon, and 6 p.m. This is an example of extra label because you are giving authorization from the veterinarian. Number 7, the label says administer only to lactating females, and your veterinarian says to give the medicine to your 3-week-old calf, piglet, or lamb. This is an example of extra label. And the last question, number 8. The label says to treat for 5 days. Your first treatment is Monday, and you give the last shot on Friday. This is an example of okay. Alright, we're now going to look at the medication labels. Before administering any drug to an animal, you must know what information is on the drug label. Looking at number 1, omnibiotic, that is as far as the name of the drug. Number 2, hydroxylin, that is the active ingredients of the product. Our next item that we have followed that, directions for use. See the package inserts. Usually there'll be some inserts there that give you information, and we're going to cover some of those things. In the area that you have the number 3, caution and warnings. For instance, there in your example, warning, the use of this drug must be discontinued for 30 days before treated animals are slaughtered for food. This is very important, as we mentioned about the food chain earlier. If you're giving a product of an ingredient that is going to go into the meat, into the food chain, and that animal is still going to travel and might make it into the processing plant, you're looking at having that product in that meat. And where's that meat going? It's going to go to the consumer. And if that medication is still in there, you can probably cause death to that consumer that's going to be eating that product. So that is very important that you know what the warnings are as far as the drugs being administered. Number 4 would be the withdrawal time. Exceeding the highest recommended dosage level may result in antibiotic residues in the meat or milk beyond the withdrawal period. So that's usually in that warning area. Number 5, the storage. You need to make sure you store your product within a certain degrees. In this example, you have 2 degrees and 89 degrees Celsius. It could be as far as 36 and 46 degrees Fahrenheit. Keeping dry and away from light. You need to keep it dry and away from the light. These are telling you the proper things that you must follow with that bottle. Don't have this bottle, this medication, and throw it in the back of your truck, where in our area, how hot our days are in the summer, you're looking at 100 degrees. If you keep that bottle in your toolbox or so, you can cause ingredients in that bottle to dull out, and it's not going to perform the way it should, the way that product should be acting as far as in the animal. Number 6, we're looking at the quantity of the content. There we have the net content being 100 milligrams as far as the product that is actually contained in that bottle. Number 7, the distributor. In this case, we have the USA Animal Health Inc. is the distributor of this product. And number 8, the expiration date. In this case, we have where it says destroy after August 13, 2002. This expiration date is important because when you go and you buy this product at your local feed store where they have this product, you need to look at it and make sure that it's not expired. Having a product that is expired may not perform the way it should, and you need to make sure that you tell the person there at the feed store that he needs to get you a prescribed drug or medication that is up to date so it can perform the way it should. And If you do have a bottle at home that you have refrigerated, or depending on where it tells you you're supposed to keep this medication, whether in a refrigerator or if it's in a shelf, make sure it's in a cool place. Always make sure you look at the expiration date, because if it's out of date, it's not going to perform the way you want it on that animal. Giving the injections properly, making sure that you read the label to find out how the injection should be given. In the skin, as far as sub-Q, or in the muscle, we have intermuscular. Injection methods and sites are different depending on the species. For instance, looking at the picture that you have in front of you, cattle, towards the hind quarter area. Notice how it's not recommended for you to administer in this area. Years back, it had been administered, and they found that one of the meat products coming out of that area had residue into the muscle, and we'll show you a picture of that a little later in the slide here. And if you have residue of a product, of an antibiotic that goes into that area, and if it makes it into the food chain, this is not something you would want to take home and eat a product that has any type of residue from any of the medications that are out there. It can be harmful, it can cause death, and this is not something you want to have on your plate. So within the current years, they have shown, if you look towards the neck of that cattle, or the picture there of the beef cow, you can see, or the steer, you can see that they have applied an area in a triangle right on the neck area. And that is one of the common places to inject cattle. One of the things you need to look at is restraining the animal, because when you have this animal in the squeeze chute, you need to watch your hands, your arms when administering medication in this area, because you have the animal moving a lot, and if you get your hands in the way, you can get your hand bruised, or you can even break your arm or such. So you've got to be very careful in the squeeze chute when administering the animals. Right behind the shoulder there, you have a question mark, and depending on the type of medications where it tells you that you can go ahead and apply some of this medication, make sure you read the label. Usually subcutaneous is done right there, right between the first rib of the animal and the shoulder, where this medication is going to go in between the skin and the muscle. So depending on what the label says, read it, and it'll tell you where to administer your injection. Looking at the hog on your right of the picture there, you have a hog, you have some areas where it's not recommended. Let me ask you this. Why do you think it's not recommended on the back, where you're looking at the loin, or on the ham of that hog? What would your answer be there? Well, one of the reasons is on the hog, on the loin on the top, you're talking about one of the most expensive cuts that come out of that species. And if you did an injection in that area, you're just ruining that great quality of meat that comes from that area, and you're taking a large percentage of loss of that animal. That as far as the yield that comes out of that animal, you're losing that there. Also in the ham, if you inject, an injection in that area, you don't want to see residue in that area, because that is a very high product that is taken to our food stores during Christmas. In the ham, if you remember, probably on your table there, you see the nice ham. You don't want to have any residue of any kind of chemicals in that area. So the area of choice here would be in that neck area, where not much of consumption of meat comes from that area. So these are some areas as far as administering your injections. Make sure that you read more information on this that we'll share with you, and follow these procedures when injecting your animals. Choose the right size and gauge of needle for the species and the individual animal size. For instance, there are certain sizes of needles, whether 16 gauge to 18 gauge to 20 gauge, that you're supposed to use on certain animals, depending on the type of medications that are being administered. Let me give you an example. There are some ingredients in some of the medications that are lighter as far as, for example, like water, compared to other ingredients that might be something like pancake syrup. And if the liquid is light, it's not that thick, you can use a needle that is a lot more narrower compared to a needle that is wider in diameter. It's easier for you to absorb with a needle gauge that has a narrow, that is very narrow, to take in, ingest something like water, compared to try to get a thin needle to try to suck up some of the ingredient, like if it was, like I mentioned earlier, something thicker like a pancake syrup. So depending on what the label says on that bottle, that's the size recommended that you're supposed to use on that animal. Don't use a needle that has been bent, shaft, or burr in it. That's the last thing you want to do, is to, if you have a needle that bends, dispose of it properly. Usually save that that cover that comes on the tip of the needle, and place it somewhere that when you're done with it, or if it's slightly bent, you can put it back over that needle. Find something, some canister. Usually, if you have a water bottle or something that is empty, put that syringe in that water bottle, seal it tightly, and make sure you dispose of it properly. And that's the next one down the line. Dispose of the needles properly in, if it's in a puncture-proof container.
Okay, I'm going to be covering some important points on injections, some of the stuff that Ronnie possibly hasn't covered. And if you're following along in your handbook, there is a handout that you can follow along. One of the things that hasn't been covered when it comes to choosing the correct needle, or talking about needles, is many a times we kind of get carried away and we use these needles more than what we should. It is recommended that some of these needles be used not more than 10 to 15 times. Many times we'll keep these needles in our refrigerators, and we'll use them more than what you should. And what that does, it dulls out the needles, and it makes it a little bit more difficult when administering them. When you usually administer these injections, it will hurt the animal if it's not properly restrained. You can either hurt the animal or hurt yourself. Another thing that I wanted to discuss about injection sites, and it's something that's important on some of these larger animal species like cattle. You may be injecting more than 10 cc's of a product. On a bigger animal like that, if you're injecting more than 10 cc's, you may want to go ahead and divide that medication out into 2 injections. You may want to go ahead and administer 5 cc's on one side of the neck, and the other 5 cc's on the other. And that way you're not going and adding all of the product in one size that could hurt the animal, if it cause pain. Also, if you're administering more than one type of medication, whether it's an antibiotic followed by a dewormer or whatnot, use the same instructions. Go ahead and inject on one side. You may want to use the dewormer on one side and the antibiotic on the other, or vitamin supplement, whatever you may be using. Those are two things one thing to keep in mind. I know we've discussed the handling of these medications, but it's very important when you go to the feed stores and you find, or wherever you do your shopping for these medications, sometimes you'll see these products out on the shelf, and then you get to reading the label, and it should have been refrigerated. Well, it wasn't refrigerated at the proper temperature. That medication probably lost its effectiveness, and it will not be any good. Sometimes we take these products out to the barn with us, and in the process we will not will not store it at the proper temperature for, let's say, the 2 hours that we're out there, getting the cattle restrained, getting them pinned up. And in those 2 hours, you can ruin that medication if it's not properly stored. So get yourself a little ice chest, put some ice in there. If it's asking for it to be cooled, if it's asking for the medication to not be into any sunlight, keep it covered away from the sunlight. And again, you're trying to maximize the effectiveness of this medication. So try to follow all these directions as best as you can. Also maintain your records. We've talked a lot about withdrawal periods, and if we just don't write these when these medications were administered, the withdrawal time, sometimes we forget. I think we did it last Tuesday. I think we did it last Monday. But if we don't write these things down on the calendar or somewhere, we may forget. So those are good practices to have. In this slide here, we're seeing this animal that's been restrained. It's probably a show steer, and we can see the triangle in the neck area. I think we discussed earlier that this would be a good area to go ahead and administer, whether it's intramuscular injection or a subcutaneous injection, and that's usually where it's recommended. And like Ronnie mentioned earlier, try to avoid the back area or the areas where the more expensive products or meat products are coming from. In this slide, we're actually seeing two round steaks, and again, the round steaks come from the hindquarters, where an injection was given, and on the lower portion of those steaks, you can see actually an abscess being formed, or that was formed, and thus ruining that portion of the meat, and that's where the bulk of the good quality meat is coming from this carcass. So once that's ruined, the packer is not going to be very happy, because he purchased a product that he thought he was going to be able to use all the meat from, and now he's got to destroy this. On a rare occasion, this may be missed, and it'll end up at a grocery store somewhere, at a meat market, and once these abscesses are cooked or they're browned a little bit, you won't notice it. And if you're a consumer and you bite down on this, you might be eating some of that residue left over from that medication. So certainly we're trying to avoid this. I'm not saying that this happens regularly, and I know that through education and all the efforts of a lot of people, we've actually minimized a lot of this, and we probably have some of the safest food products in the world here in the United States. Let's go ahead and talk a little bit about withdrawal time. And I know we mentioned it a lot, and that's the amount of time that's required for the medication to be metabolized or broken down by the animal's body to levels that are safe for human consumptions. Withdrawal times are determined by research that is regulated by the federal government. That research is usually done by the Food and Drug Administration. And these withdrawal times are on the label, so make sure that before you administer any type of medication that you read those labels again, get acquainted with them, know when those withdrawal times are, write them down, that way you won't forget. In this example, we've got a medication label. One of the important things to point out here again, it's right in the middle of the label. We've got a warning, and it says that the animal cannot be, or the animal after it's been treated, it cannot enter into any type of, or into the food chain until 30 days afterwards. It's also in the bottom. Another thing that's important is the storage. You know, the temperature. It's 36 degrees and 46 degrees Fahrenheit. And like we talked about earlier too, we've got also an expiration at the very bottom. These are all very, very important things that we need to be aware of before we use any of this medication. In this slide, I know we did an exercise earlier on extra label drug use, and that's following the label instructions, but then following also the advice of a veterinarian. Now, the veterinarian says to go ahead and use 20 cc's of a certain product, and the label says to use 12. Well, that's legal. The veterinarian actually told you that you can do that, but this is going to compromise the withdrawal time of this medication. So if that happens, make sure before you leave the veterinarian's office that you ask him or her when this animal can, when the withdrawal time of that medication is, so that if there is a change, you can go ahead and write it down on your records and avoid any further problems.